Welcome to the Global Discussion, discussions with creatives, leaders and thinkers. My name is Simon Hodgkins. Absolutely delighted today to be joined by Martin Curley. Martin, you're very welcome to the podcast. Let's begin by asking you to introduce yourself to our worldwide audience. You're joining me here today, live from Barcelona, so it's great to catch up with you today. You're a professor of innovation at Maynooth University. You're a visiting professor at University of Bath, and you were the prior Director of Digital Transformation and Open Innovation at the HSE, which is the Health Service Executive responsible for all healthcare and public services in Ireland. So over to you. Could you tell us a little bit about your journey, Martin?
Great, and Simon, thanks so much. And Hola from Barcelona. It's a great honor to be with you today. So I'm an electronic engineer. I've spent about 30 years in the high-tech industry. I worked with Philips, GE, Intel, and MasterCard. I've written a number of books, and 5 years ago, I joined the Health Service Executive as the CIO, and I had an idea about how we might transform healthcare in Ireland. I actually quickly realized that wasn't going to be possible through the IT organization. And I was able to, with John Connaughton, who was the then acting director of the HSE, we were able to create a new function, digital transformation and open innovation. And I've been deploying principles that were developed in the book that I wrote with Bror Salmon, Open Innovation 2.0, to try and architect and mastermind a transformation of the health service. We made remarkable progress. We worked with clinicians, we worked with patients, we worked with administrators, and we had a network of living labs deployed across the country with some really phenomenal results, like 10-time reductions in heart failure admissions, 10-time reductions in respiratory admissions. But ultimately, I was involved in a culture war. And, Eric Topol, the renowned cardiologist, would say that medicine is probably the most resistant, industry to change. And I certainly found that. So ultimately, I decided to leave. And actually, there was a better path to healthcare transformation outside of the former healthcare system. And as a citizen of the planet, I'm actually committed to driving healthcare change through digital technology. And I think I know how to achieve that, and there are many others that think like me. So I'm really on that journey. So I'm delighted I'm a professor of innovation at Maynooth University, and as you mentioned, recently taken a visiting role at Bath. And the primary vehicle that I'm using to try and drive this global transition is United Nations General Assembly Science Summit Digital Health Symposium. And here in Barcelona this week, we're launching the Manhattan Manifesto. And we have 50 global signatories to the Manhattan Manifesto. And it's 12 guidelines to help governments and health systems transform using digital.
Well, thank you very much indeed, Martin. I'm going to come back and touch on a couple of those areas if I can in a moment, but the manifesto is such an important, is coming at such an important time because we've been through a global pandemic and many health systems around the world need an awful lot of, can I say it carefully, improvement in lots of areas. And I think it's incredible in terms of the work that you've done. And I think it's incredible in terms of the work that you're doing. And I know some of your recent decision to, maybe tackle this problem from a slightly different angle and not in your former role was pretty big international news. It was certainly very large news in Ireland. And I know that you're very respected in terms of your thoughts and your background. And I want to come back to that first, if I can, in terms of your background and your engineering background, because I know, back to maybe Philips in the Netherlands, and then you spent an awful lot of time with the Intel Corporation, didn't you, who have a very large facility operation, I suppose, in Ireland, whether it was as the global director for IT innovation there or as the vice president and senior principal engineer for Intel Labs in Europe. So that must have been a very interesting journey because I think you were there in total for maybe, I don't know, what was it, 10, 15 years?
Actually, 25 years.
25 years in total at Intel, was it?
It was phenomenal. I loved working for Intel, and I had a particular affinity with one of the Intel CEOs, Paul Ottolini. He had a fabulous vision, which was that Intel would create and extend computing technology to connect and enrich the lives of everybody on the planet. And that really spoke to me. I'm very much, purpose driven, but it also makes economic sense. So under Paul Ottolini's leadership, who sadly passed away 3 or 4 years ago, the cumulative, net income and net revenue was more than all of the previous Intel CEOs combined. So doing good and being purposeful makes sense. But there's a lot I can translate from, and was one of the reasons I moved to the health service. A modern semiconductor fab, such as say Fab 24 and Intel in Leixlip, it's at least 10 times, if not 100 times more complex than a modern acute hospital. And there are problems and technologies that were deployed 30 years ago that we developed, were deployed in Fab 10, and those capabilities are still not present in modern day hospitals, at least in Ireland. So if I can give you one example, Simon, today we probably have about 3 million medication errors a year in Ireland. So that's one medication error per patient per day. And in some cases, that actually can be very problematic. And some cases people can die. And as you may know, in the US, the third largest cause of death is medical errors. But when I joined Intel in Phoenix, Arizona in 1992, we had a problem in our factories. We had a misprocessing rate of about 3% of our wafers. And depending where those wafers were in the manufacturing cycle, every time you did that, you blew away $1 million or million euros. But the problem, if you make a serious medication mistake, is not about money. It's about actually people's lives. But by developing software, we call it station control software, we were actually in less than 6 months able to eliminate completely misprocessing. So we were always able to make sure, manufacturing and healthcare is like a manufacturing process. You need to have man, machine, material, and method all synchronized. So, in early 1993, we had eliminated all misprocessing. We're still in healthcare systems around the world, and particularly Ireland, where we have the equivalent of misprocessing. So just taking that technology and applying it to healthcare can solve a lot of problems. And that's one of my motivations. I work with Professor Linda Nunes and Dr. Charles Larkin at the University of Bath. And one of the things we're looking at is taking digital manufacturing techniques and applying them to healthcare. And in general, we've made remarkable progress in healthcare globally. Over just the last 2 centuries, life expectancy has more than doubled from about 30 years per person to, well north of 70. So we've had amazing progress in, the invention of, discovery of penicillin and, stents and all sorts of innovations. But the healthcare system, as we currently know it, Simon, and you probably recognize this, is breaking down. And, the deployment of both digital technology and digital manufacturing and, techniques like Deming and Short advocate of statistical process control, these can drive remarkable improvements. And I think we can look to Thomas Kuhn. He wrote the book, The Structure of Scientific Revolutions. And what he argues is there are periods of complete discontinuity in science where the normal model breaks down. You get a model crisis, and that leads to a new paradigm. And I think that's exactly what we're seeing in healthcare around the world, whether it's, the Financial Times or Time Magazine. There was an interesting article a couple of weeks ago, senior US doctor saying it's not the workload that's, fatiguing us and, destroying our morale. It's the fact that we're working with a broken healthcare system. There's very little hope. People see workload going up, people are getting older, the demand is going up, and there's nobody coming forth with solutions. So what I've been advocating is trying to make healthcare reform very simple and, create a mantra, which is just 6 words, and to use this to, globally align, accelerate, and amplify health efforts or digital health innovation efforts. And we call this Stay Left, Shift Left, 10X, and maybe can explain that very briefly. So Stay Left is about using digital technology to keep people well, or if you need rehab or have a chronic condition, that we can do this best of all from home. Shift left's about moving patients as quickly as possible from an acute to a community to a home setting. And then the last piece is probably the most important, is the idea of 10x that, and what we've observed in a network of living labs in Ireland, and we've been validating this with the University of Bath, every time we deploy digital technology to healthcare, which is information intensive, and we use an exponential innovation methodology, we call that the OI2 living labs, we're seeing 10 times better, 10 times faster, 10 times cheaper, 10 times higher volume. It's absolutely, remarkable. You might have heard the expression, come at the hour, come at the man. Well, in this case, it's come at the hour, it's come at the technology. And I see, Simon, 3 Copernican shifts that must happen and can happen and are happening. The first is shifting from an illness system to a wellness system. And today in Europe, we spend 97% on average of our budget on illness and just 3% on wellness. But the returns are massive. They're 10x more if we invest in wellness. And can you imagine a bank or a venture capitalist putting 90%, 97% of the funding into the lowest performing part of the portfolio? It's insane, but that's what's happening. But this isn't to say that we don't need hospitals. Of course we do, because people get sick, people can have accidents. We're actually going to need mostly a different kind of hospital, which is the second Copernican shift. We're going to move from hospital to home. So already we have technologies, and one example is from Wear, a Scottish company. They have a small credit card device that I wear my arm, and you can get better vital signs in your home than you can actually in any Irish hospital, and they're continuous, they're real time. We can alert on these. So nobody really wants to go to a hospital. I do have an aunt who likes going to a hospital. She hopes she doesn't watch this. But most people want to stay at home. And the good news is we can treat people at home as good as, if not better, than in the hospital. And we can do, home intravenous IV. We can, do home, chemotherapy. So that's the second shift. And the third shift is an incredibly empowering one. And this is moving from doctor knows best to patients know best. Patients spend most of the time caring for themselves, but in the past they weren't really educated. But now with new modes of patient education, with the Internet of Things, like very simple things like blood glucose meters, I've been experimenting with one myself, and I've learned remarkably, what not to eat to drive my, blood glucose level high. But what I observed is just doing some exercise directly after eating really stabilized my blood sugar. And I just came across a book last week. I was actually in Gran Canaria, and it's called La Revolución de la Glucose, or the Glucose Revolution. And it's some very simple techniques, if people were educated, could really stabilize blood sugars. And the research is showing that blood sugar levels are not just an issue for people with diabetes, but blood sugar levels that aren't controlled can lead to earlier onset of dementia and all sorts of different conditions. And if we can just educate people, so this third area of the patient taking control, now it is co-creation. We always will need doctors, but if we think about the determinants of health, just 10% of health outcomes, and there's some really good research on that, are driven by clinical efforts. And again, we're investing almost all of our budget into clinical care, and clinical care has been hugely important. In the last 50 years, we've driven massive life expectancy improvements due to that. But actually, the big returns are elsewhere. So exercise and nutrition are 40% of our health outcomes. Our genomics are 30%. Environmental and social conditions are 15%, and so on. And healthcare is just 10%. So we can educate patients, and movement is music. Our movement is medicine. That can be really important. So the combination of IoT and educated patients, I think we could add 2.5 years of healthy life to everybody on the planet, for the next 20 years. So you and I, Simon, if we use these technologies, we follow these better regimes, we could add 10 years to our lives, and we could do that for everybody in the planet. And about 50% of people on the planet don't have access to care, and digital is going to make it much more affordable, much more accessible, much more consumable. So I think the future is really exciting, but we actually have to make a decision as a society and as a political decision that we actually want this transition. It just makes complete sense. So that's what I'm pushing for, and that's why I'm working in digital healthcare.
Well, listen, that's wonderful, and you've made some very, very important points there. I certainly like, from illness to wellness, and when you talked about it, looking at it from a business perspective, would you invest all your money in the bottom part of the equation? That's quite interesting. And it reminded me, I reflected back to, I don't know if you knew the gentleman, but there was a Northern Irish businessman, Jerry Robinson, lived in the North, and he had a TV program, I think it was with Granada or ITV back in the days in Europe, which was, Can He Fix the NHS? And this TV program showed a little bit behind the scenes that the complete disconnect between, now I'm going back quite a few years, but the complete disconnect between sort of modern technology, business processes, a different way of thinking or looking at it through a different lens. And it was sort of this battle between the status quo, the institution of healthcare, and a government wrangle, which seems to be probably raging as strong as it ever has today. And that program was probably back in 2007, something like that,
Yeah, and I do recall it. And the tragedy is we have the technology and people want it. What I've made of my business is, every week to be out with the doctors, the nurses, the patients, the physios, and the pharmacists. And we created a national masters with 8 universities, and we specifically designed that to be not just sort of educating the doctors and nurses, the digital workforce of the future, but instead of the clinicians, writing 30,000 word dissertation, they didn't do that. We asked them to drive, conceive and drive and develop a digital change project. So we now have a mechanism. We've had over 50 digital change projects driven into the Irish healthcare system, by our clinicians, and it's been fantastic. But as an innovation professor and as an innovator, resistance is normal, and there are things you can do though to design for adoption. In fact, that's one of the key patterns, Simon, in Open Innovation 2.0. So you design for the user experience, you design for utility, you design for ubiquity, and very much having the users part of the, be that a patient or a pharmacist as part of the process. And you can actually design solutions that are really compelling and they really target the pain point. So we did that in multiple living labs, where in digital dermatology with, Owen O'Reilly, and remarkable results like the waitlist in St. James's for dermatology were reduced 60%. We think we could reduce the number of deaths in Ireland in skin cancer by a factor of 10x, from 1,500 a year to 150. Now, 150 is still too many. And, if we continue to deploy these solutions, we'll get that down even more, because early detection is so important. And then the idea of these solutions that are 10x, like, we have 1,000 patients in virtual respiratory wards. These are cystic fibrosis patients. They're patients with COPD, and they're being able to stay at home. For a CF patient, a huge risk is going into the hospital and picking up hospital-acquired infections. So they can stay at home. But they are saving, in a study with Mike O'Malley in Galway, Dr. Mike O'Malley, over 950 euros a year just on travel costs. So these are multifactorial benefits. They're all 10x, and yet they're being resisted and not adopted. And I think we can do much better out of the system. People like Helen Bevan in the NHS, she was the transformation director, and she talked about the idea of a culture war. There is the command and control of the old world versus, the networked organization. And ultimately, the network is going to win. Now, some hierarchy is still necessary, but despite the fact that we designed for adoption, we designed these solutions with doctors and nurses and patients, despite the fact that we're very clear, 10x benefits, 10 times faster, 10 times better, 10 times, we met extreme resistance from just a small pocket of people, typically non-clinical administrators. And I said on Virgin TV, these are people who value power over purpose, over progress, and over patients and people. Ultimately, digital has to win because it's going to affect everybody, all of us, you, I, our families, our friends. So the idea of Stay Left, Shift Left 10X is a national digital health strategy. It's not just about health, but it's about enterprise and economy, and it's about sustainability. So working with Leo Clancy of Enterprise Ireland, we think we can, have a 10x increase in digital health exports from our SMEs. And again, we've made remarkable progress in, just 3 or 4 years. 4 or 5 years ago, we probably had 1 or 2 digital health SMEs that were able to penetrate the HSE. And last September at the United Nations General Assembly, we were able, together with Enterprise Ireland, announce the first 25. So a playbook of 25 Irish digital health SMEs that most of them didn't exist 4 years ago. COVID became a remarkable enabler. And these now have solutions, deployed across Ireland in living labs that are delivering 10x benefits. But the economic returns, in the work that we're doing at the University of Bath, and I had done a preliminary analysis myself, and the numbers were so good, I had to go to someone else to say, look, let's validate this. So we've been working with the health economists led by Dr. Charles Locker in the University of Bath, and what we're routinely seeing, for example, for our vital signs automation solution, 1,100% return. For digital ultrasound, we're seeing about 3,000% return. And incredibly, for our virtual respiratory ward, we were seeing more than a 10,000% return. And this is amazing, but it's also a real paradox because unfortunately, Ireland has the highest rate of respiratory admissions in the world, or in Europe, and we have almost the cleanest air. And now we have a solution that can keep all of those patients at home, but it's not being, deployed. There's such reticence and slowness to adopt it. So, and the case of vital signs automation solution in Ireland is also a very difficult one because this is a great technology. It catches deteriorating patients much earlier. And in effect, because what we've seen, we've been working with David Toohey, who's the CEO of Synchrify, and they have great data. They've deployed extensively with NHS in Scotland, and what they've seen on average, at least a 15% reduction in average length of stay. And this directly, turns into increased capacity. So having worked through the business case with David, we think we can provide new acute capacity through better use of digital and information at least 1/100th of the cost of providing a new bed in Ireland. So in Ireland, it costs about €1 million to procure, and deploy a new bed. It costs about 300,000 a year to staff that. If you can use digital technology to improve capacity for a fraction of that investment, 1/100, it's a really smart thing to do. But even more important, unfortunately, the tragic case of Savita Halappanaar I think in 2015 in University Hospital Galway, there was a HICWA report from that said, look, we need this kind of technology deployed in Irish hospitals. And we deployed it into, Cavan, we deployed it into Tala, and now there is a program to deploy it into 20 wards across the country, but it is just so slow. Like we deployed it into Tala in 3 weeks, but the purchase order was signed a year ago. I was just talking to David Toohey 2 or 3 weeks ago, and it's only deployed in 3 hospitals now. The third one, St. Luke's in Kilkenny, it proved so valuable that St. Luke's themselves said, okay, we're going to deploy this into all our other wards, and that's currently underway. But relying on this central hierarchy, the HSE to do this. It's just too far removed, and there's a culture issue and there's inertia. So we have to do things differently.
There's an awful lot to unpack. There's an awful lot to think about. And again, to me, looking at it, I'm no healthcare expert, obviously, but the technology has advanced significantly. To me, I'm likening it, it's probably a bad example, but it's like you mentioned the pandemic where people just had to work from home. We had to figure out a different way of doing business. And it sounds like, from the way you described it, that a lot of these technologies and sensors and in-home care can actually give you a better read than maybe being sitting on a ward taking up that bed. And the other thing that really stands out to me, as somebody who's experienced this through my own family, is there's a huge shortage of beds. We've probably been through, at the time of recording, one of the worst periods in Irish history in terms of lack of beds, lack of healthcare availability. The frontline workers seem to be trying the best they can. Everybody seems to be frustrated with the service, and people are left waiting, on trolleys, or even if they're lucky enough to get a trolley, some of them left on chairs for many, many hours. And it is an extremely frustrating situation for anybody who's experienced that firsthand, whether personally or through their family members or loved ones. But also, when I hear you talk, it seems like a lot of these solutions are available, but are being rolled out. And it's that slow, almost glacier rollout that really seems to be able to bring some significant results. And you're talking, 10,000% improvements or 10x improvements, or, the numbers that you're throwing out are quite staggering. So hopefully we'll get to address that. But just in summary, because I do want to squeeze in a few more questions before we run out of time. What do you think is the next step? Obviously, you're working at a United Nations level. You're a huge advocate in terms of making this work. And, I can see the connection between your engineering, the IoT type argument, and how these smart devices can give you a real read, regardless almost of where you are on the planet, whether you're an Irish citizen or an Irish user of the Irish healthcare system in this case. But where to next? I mean, what for you, when you look at it from your perspective, because you've got extremely in-depth knowledge, having both worked inside and outside of this huge challenge that we're faced with. What's next? Where do we go?
Well, I think it's, Simon, and that was actually a very good summary. It's all about mindset and culture. And 30 years ago, Watt Humphreys said every business is a software business. And recently the Microsoft CEO said that. And I think we need to think about health and healthcare as a software business. It is an information business. And you and I and everybody else, I expect in 3, 4, 5 years, we're going to be generating 100 times more data than we currently generate. And we'll be able to proactively, very early detect chronic disease. And this is hugely important because, Simon, 70% of all deaths come from chronic disease that's not detected or not managed. In the US, 90% of all costs comes from chronic disease. So by purely taking an information age approach and treating health as a software business, we can do remarkable things. But it's very much about mindset and culture. And what I would question, I think there's a massive opportunity for non-government players to come in and be successful. We're on the cusp of a remarkable change because, the numbers I'm throwing at you, and they're real, 1,000% return, 800% return. They're strong commercial returns, but the returns in terms of actually extending and saving human lives, they can't be ignored. So if we look at a parallel, and whole genome sequencing is a massive opportunity. I mentioned 30% of our health outcomes are driven by our, genetics. When 20 years ago it cost $1 billion to do it, now it's 300 or 400 euros. But the health systems are moving very slowly to adopt this. So about 40 million people globally have had their whole genome sequenced, but almost all of them have actually gone directly to a B2C firm, a business to consumer. So I think there's a massive opportunity for companies that can introduce global platforms that go direct to the consumer. We're all willing to pay €10 for a Spotify service for our music and, do our shopping at home. I think actually consumers would be willing to pay, not huge amount, but some amount for actually having a managed health service. So we all have, or we don't, many people have financial plans. They plan for life. Why not, health plan? So I think we're on the point of a major disruption. Unfortunately, the healthcare system, the government-run healthcare systems, and there is a lot of goodness in them. I wouldn't want to say, look, there's fantastic clinicians, there are brilliant administrators, there are great services, but the technology is enabling something completely new. And the OECD published a report 2 years ago, healthcare in the 21st century, and what they said is, the culture and the processes and procedures, they were developed, were forged, and they use the word forged, I think deliberately, long before the digital revolution, came. So the challenge is for us to collectively reimagine a new kind of healthcare system, re-architect it and re-engineer it. And myself and people like Prashant Parida in New York, we have a vision of a new digital health system, which based on the patient, and they have their mobile phone, their electronic health record on the mobile phone. And we work with Dr. Mohammed Ayub Ali, based in the UK, with the Patients Know Best platform. He was a clinician that had a rare disease himself, and he developed a platform. Now 1,000 or million, more than 1 million patients have their own personal electronic health record. And when you're empowered with that and enabled, and when you're educated, that's how we're going to, leap forward. So, Michael Porter talked about, the 5 forces shaping an industry, and what is going to happen is power is going to shift to the consumer. We have a consumer experience for music, for banking, for retail. We need that in healthcare, and I don't think it's going to come from the government organizations. There's absolutely still a role for the government organizations, and they provide vital infrastructure and vital investment. But ideally, I would like it to come from a public-private partnership, but it may come from a private player that just provides a solution that's so compelling, that's so convenient, that it'll just get adopted. But yeah, it's entirely impossible. We can all live longer. One of my colleagues, John Shaw, he's the CEO of Carillon, and he says, people will look back in the future and say, what were people thinking in 2023 when our cars were better instrumented than us as humans? We know when we need an oil change. We know when our tire pressure is down. We know when the brake pads needs changing, but we don't know this. We find out too often. We find out too late in A&E. Oh my gosh, you have a stage 2, cancer diagnosis, or you've got hypertensive crisis, and we have all the technologies. It's affordable at consumer prices. So what we need, I think, is a global effort. And maybe just to think about, you might have heard the expression, Simon, let chaos reign, and then reign in chaos. And why I've been advocating stay left, shift left 10x is we have this, this Cambrian explosion of digital health innovation. It's like the Californian gold rush. It's hugely exciting, but at the moment it's not directed in one direction. And Richard Jones, one of my president of C2AI, he talks about, if you're not doing something that's stay left, shift and 10x, you shouldn't be doing it. But if we can align all these innovation efforts, they actually complement each other, they actually compound each other, and we can go much faster. And the whole idea of open innovation 2.0, and why I'm so optimistic, one of the key design platforms is platforms and ecosystems. And what the research is showing, that the dynamics that normally might take 30 to 40 years to play out in an industry can be achieved in 7 or 8 years using platform ecosystems. So this is where you have a common platform, and we've massively distributed innovation, parallel innovation. It's also you massively shared risk, and massively greater return. So by using a common platform and a common lens, we can go much, much faster.
Yeah, again, excellent points. And it's a little bit like the, back to COVID, where the world had to get together and said, look, we need to speed up the vaccine approval process. We need to get this thing out faster. And I'm also reminded of things like generic medicines, sorry, compared to branded medicines with the same active ingredient, and the backlash that took place there, and the sort of infighting and the politics that played a part there. And it just takes longer to roll this stuff out. But it sounds like as well, the last thing I'd say on it, just just thinking about what you're saying here, we saw Amazon sort of entering to some degree at some point there a number of years ago, the sort of drug distribution market in terms of sort of chemists, I suppose, or pharmacies. And it isn't, a stretch too far for the imagination to see a company like Apple, for example, decide to roll out more. Like, you're wearing an Apple smartwatch today, which has quite a lot of sophisticated sensors built into it. And there's many other companies that provide sensors and technologies to track health signs, vital signs. And as you've already mentioned, there are lots of these companies that maybe didn't exist 4 or 5 years ago, where the technology is almost shrunk, more accurate, more available. And it's the democratization of that healthcare, I suppose, where it moves into this B2C model that you're sort of referencing. But look, I really appreciate your thoughts. Yeah.
Yeah, no, exactly. And actually, what we've tried to establish in Ireland and what we're trying to establish globally is an open collaborative ecosystem. And these are hugely important because we can go much faster when we're collaborating, with a shared vision, which we call stay left, shift left, 10x, and we have shared values, and we're trying to create shared value. But one of the innovations that I thought was fabulous, I'm most proud of, we almost call it the Ocean's 11 innovation, was the Health Elevator project, where we worked with Care Plus Pharmacy, we worked with Full Health Medical, we worked with AWS, we worked with Roche, and 6 or 7 other companies. And the idea that you could go to your pharmacy and you could do a 15 health check. We have to bring our cars every couple of years for an MOT. That every year you could go to your pharmacy in 15 minutes, you could get your bloods done, you could get a HbA1c test, which is for diabetes, you get an AFib test, you get a peak flow for respiratory, and a number of other tests. And in 15 minutes, we could do that analysis. Now, it takes 24 hours. We're working with Eurofins to process the bloods, but in 24 hours, you would get a personal electronic health record. You would get a report identifying what are the risk factors, and you'd also, and actually it's a Fitbit, you get a Fitbit or similar device, which would allow you to manage, your health much better. And we could do all of this for about the cost of a PCR test. This is a solution that unfortunately was blocked by these non-clinical administrators. And Ireland could be the first country in the world where every citizen every year gets a personal health check and has the tools to self-manage. And what's really important is what we found, Full Health Medical are the company at the core of this, and they've done, tens and maybe hundreds of thousands of these medicals in the UK. 1 in 5 people have a critical risk factor that's identified. In fact, in our living lab, several people had to go direct to A&E because, we saw problems that immediately warranted attention. But if we can, 1 in 5 people have a problem, every year or two that you leave this problem, the costs go up 10x, and the pain, and in some cases it leads to death. And diabetes, for example, is particularly tricky. People lose, fingers and particularly toes. So there's a real opportunity. I think you've been working, for example, with John Carroll, who's the CEO of Care Plus Pharmacies, and he shares this vision in 80 stack pharmacies. There's a real opportunity to leverage community pharmacy as an untapped resource. So right now our GPs carry much of the work. 90% of all appointments are going through the GPs, and recently Alona Duffy and Monaghan, look, the funding for the GPs is just about 5% of the overall system. That was an eye opener for me. But right now the GPs are, they're completely overwhelmed. Many of them are old, many of them are retiring. But if we could shift this workload to the pharmacists, this would be phenomenal. It also solves the problem for the pharmacies, because there's quite an issue with young pharmacists who are unsatisfied and are leaving. But if we can have them operate at the top of their license, they conduct this 15-minute test in each pharmacy. And each pharmacy by law needs a consulting room. We would massively, rebalance and bring the system more into equilibrium. And one of the reasons, Simon, I'm so hopeful, Ilya Prigogine, he was a Nobel Prize winner, but he said when a system is far from equilibrium, as is our healthcare systems, small islands of coherence have the ability to transform the whole system. So what I'm imagining is we're going to have a metamorphosis by doing these small changes all aligned with stay left, shift left across the health system. We're going to have a metamorphosis, and from a caterpillar to a butterfly, spontaneously at a certain moment, we're actually going to see a new form of system emerge, and that will be a new digital health platform that puts the patient at the center. That we can increase hospital capacity by a factor of 10x because people are being treated in their home, and is going to extend lives and ameliorate suffering, because something interesting has happened. Even though life expectancy has dramatically increased, and that's marvelous, the percentage of our lives that we spend healthy and unhealthy actually hasn't changed much, and we can do a lot about that. So there is the opportunity, every child, and John Shaw talks about this day, a citizen charter, any child born today could reasonably expect to live to 100 years old and live out most of that healthily. And I think we would all want that.
Yeah, I couldn't agree more. And yeah, the Fitbit, for example, I mentioned Apple Watch, but that was acquired by Google for a few billion only a couple of years ago. But there's also this huge opportunity, isn't there, for these small, medium-sized, agile businesses that are really at the forefront of this new health tech, if I can maybe use that phrase. And it seems as though that this is happening anyway. It seems like it's going to win out ultimately, because it kind of has to. And when I think about, just in an Irish context, I know this is an international audience, but just in an Irish context, when your population's gone up by a few billion, you don't have any more beds, and this stuff isn't rolled out, it becomes very difficult. And the backlog, whether it's at the GP level or the A&E level, at the hospitals, it's a real challenge. So yeah, it sounds like there's both a huge challenge still ahead, but a huge opportunity too, and I don't want to lose sight of that.
And maybe, Simon, if I could give a couple of the opportunities, some really exciting things that that are going on, but also to mention, when COVID happened, there was two things. It became a big bang disruptor, because there was so much fear, and necessity was the mother of invention. But secondly, the people that are innovation blockers actually were too busy doing something else. So they weren't in the way. And one of our most senior politicians recently, said to me, "Martin, look, there are people that make careers out of blocking, and you don't want to actually get their backs up, because they'll block even more. But we have to go around them." But just a couple of technologies that are going to change the world. Head diagnostics. David Van Zuidam has a technology which was originally the technology discovery was, originated from St. James's Hospital, something called ocular microtremor. And David has developed a device. It actually, you shine it into your eye, and in 3 seconds, it will give you an indication whether there's early onset of a neurological disease using this OMT technology. And we want to introduce that into our health elevator check. So one of the additional things that we would do when you go to the pharmacies, you get a 3-second test. It'll say, gosh, there could be early onset of Parkinson's or Alzheimer's. Now, the thing is, right now, we haven't figured out how to cure these diseases, but we can absolutely slow them. So if there's the early onset of something, there's a lot of things we can do. A technology that we introduced with PMD are based in Cork, Respirasense. We put it into 23 hospitals. We worked with Professor Richard Koslow. The first weekend COVID was in Ireland, and we were able to quickly see that we could get 12 hours notice of a patient desaturating. So in some cases, this was life-saving, or we could avoid an intubation in ICU. But we've recently had a pilot in Donegal with Antoinette Doherty and also with the Professor Vera Keatings. And we've taken very sick patients who have COPD that on average were hospitalized once a month. But now they wear this technology at night, and Vera Keatings and Antoinette can see if a patient is deteriorating. They can activate a rescue script. We've had 100% success. So since the pilot started, we haven't had a single patient hospitalized because we're able to detect deterioration and intervene. So this is saving hospital beds. It's actually saving lives, and the patients want to stay at home. And one other technology, there's 5 or 6 vital signs I'm involved. I help advise a Portland, Oregon-based company called Matuzi. Mark Alexander is the CEO, and a lot of these new innovations come from patients having problems. So Mark had a bad car accident, and the physio was very difficult, and he developed with the physio a new body area network which measures something called ground reaction force. And this is a way of actually measuring something that previously wasn't being able to measured. To be measured. And now if you go to a physio with a problem, it could be a back problem, it could be a knee problem, you're able to actually do some tests, and it indicates to the physio, actually what the prescribed treatment and what they found. And for Mark included, the physio that he was getting was actually making the problem worse. But with this new vital signs, and we're actually talking about this as a new vital sign, a 6th vital sign, ground reaction force, we can have much faster paths to recovery, and it's cheaper of course. So, and digital ultrasound is going to be hugely important in Ireland, as in many healthcare systems. Heart failure is the #1 cause of death. In Ireland, we have an 18-month waiting list for an echo test. But now the combination of, say, the Butterfly or the GE device with Caption AI, a care worker, an untrained care worker, can do as good an echo test as a trained cardiac physiologist. So we can immediately cut out this bottleneck. And if you can quickly get a patient who's suspected with heart failure and do this echo test, the quicker they get on the path to recovery. And our work with Roche and Centric Health with Dr. Donald Bailey, we've monitored 150 heart failure patients over a year and a half, and we've seen a 10 times reduction in hospitalization. So again, this is reducing, the workload on the hospitals, but most importantly for the patients, they feel much safer. And instead of them having maybe 8 appointments a year with the cardiac, they're monitored continuously. There's a nurse line where we're looking at their weight, we're looking at their SpO2, and we've just had, I think the only hospitalization we've had is when we detected a problem with a patient, we gave them a new script, or they were given a new script, and they waited 3 days to actually get it dispensed and deployed, and by then they needed to be hospitalized. But the technology is there. We just have to decide to do it and implement it.
Thank you so much indeed for sharing that insight and those opportunities. It's been a great discussion, and I could talk to you for weeks on end about this stuff, because it's great to hear your views and opinions on this. But I do want to change gears just a little bit and just ask you a little questions just for our worldwide audience to find out a little bit more about Martin. So I wanted to ask you just a couple of quick things before we end today. And obviously, this is a huge area that requires an awful lot of cutting edge thinking, the latest news, the latest technologies. How do you onboard information? How are you keeping abreast of what's happening? Is it through meeting people, reading books, listening to podcasts, downloading white papers? What does that world of learning look like for you, Martin?
Yeah, and all of those, and actually just to congratulate you on this global discussion series, actually listening to thought leaders on a podcast, taking 30 minutes out to do that is a great way. There's a huge, networking is really important. So I've been here at Mobile World Congress, and that's been, fantastic. And, when 2 ideas or 2 half ideas come together, they don't compete, they actually complete. So one of the things I learned at Intel from a company called J&J Associates is relationships are the foundation of all accomplishment. So I invest a lot in relationships, and when you're able to have high trust, high level relationships, you can do a lot. But I use LinkedIn a lot. It's a great source of information. As an academic, I'm looking at some of the academic papers. I'm looking at the industry press, but podcasts like this are, and Blinkist is a good source. You can get a 10-12 minute summary of a new book. But it's all about people overvalue analysis and undervalue synthesis. And I think what we need to do is look at all these sources and synthesize them into nuggets of information that can be used and actioned. And it's all about action. It's not just enough to know about it, but you have to do it and act.
I absolutely love that. I couldn't agree more. 100%. Thank you. The other thing I want to ask you is, you've mentioned a lot of smart, clever, active, forward-thinking people, as we've been discussing here, the healthcare situation and the advancements in technology and development and solutions. But when I ask you about your life, your career journey, back to being a child, in your childhood, or something that happened to you in Barcelona this week, who do you admire? What people have inspired you? Who stands out? What do you think about when I ask you that question?
Yeah, loads of people I admire. I'm actually a soccer fan. I like Chelsea and West Ham. Well, actually, you think Arsene Wenger was just amazing. Now, he actually played the game. There's a lot of people in healthcare actually in leadership positions that have never done health, and I think you actually need to have played the game to be successful. But Wenger was so consistently good with moderate budgets, and he created the undefeatable. So I think he was amazing. There are so many people. I work with John Sheehan. He and I are sometimes called the two Ronnies, and John, he's a brilliant radiologist. He's the vice chair of the Irish Digital Health Leadership Group. He's an entrepreneur. He's involved with mobile medical diagnostics and X-Refer. But just want to give an example. 2 weeks ago, I was out in San Jose speaking at the Net Events, Global Tech Media Summit. And I just got a message from John's wife. Oh my gosh, John has had a bike accident, and he came off his bike, but his Apple Watch actually was able to immediately send a message. John has had a hard down to his wife and to other colleagues, and a couple of hours later, John was transformed from being a doctor and entrepreneur. Actually, he was a patient. Now, he did send me a live video of the surgeon actually operating on his wrist, which, I'm not going to be showing it to my kids. But I was able to talk about John, and John sent me the images of his new constructed wrist and his face. He had 2 or 3 hours of plastic surgery, and it was a brilliant case study. I think the man is made of steel, but we're able to use this as an exemplar. Here's John. He's a doctor. He's an entrepreneur. He's had an accident. We talked about, we're going to do health, but sometimes you need to go to a hospital. And he was willing to share his personal experience. And a number of journalists came up to me, gosh, that's so amazing that, the Apple Watch, could detect there was a fall and could immediately send the GPS. Another person I admire, for example, is Jeff Martha. He's the CEO of Medtronic, and a really good man, really smart man. I had the opportunity to have dinner with him, and he was telling about conversations, that Medtronic are having with some of the smartwatch manufacturers, and they have a device called a link, which can detect very early, the cardiac arrhythmias. And this is a device that in the past would have had to be, you'd need surgery for it, but the link can now be deployed actually in a pharmacy, by somebody with just a little bit of training. And this is game changing. And what I find the people like Neil Crescenzo, who's the CEO of Optum Change Health, these are really smart people, but the reason they're in the business is about doing good and saving lives. So, other Dr. Donald Bailey that work with Donald Morris, Anthony Staines. We have some fantastic people. I've just been with Anne Mon Johnson, who is the CEO of the American Telemedicine Association, and she flew out from Washington, D.C. to be with us here in Barcelona, and literally was here, about 30 hours. She's just gone back, and Brian O'Connor, who's the CEO of the ECH Alliance, and he's developing the ecosystem of ecosystems. And we've just agreed here that the Digital Health Society is going to diffuse the message of stay left, shift left 10x around the world. So there are individuals, and Margaret Mead once said, never doubt the ability of a small group of committed citizens to change the world. In fact, it's the only thing that ever has. So I have the privilege of working with people like Brian and John and the Donalds, and Gary Boyle, who's an amazing patient advocate. Gary has an amazing story. He had early onset of Parkinson's. It was a catastrophic diagnosis, but he talks about not being cured, but he's doing better, much better. And he recently completed his first marathon. Who could have imagined that? He inspires other Parkinson's patients, and he's been involved with Zendra Health in building an app for Parkinson's patients to support each other as a community. And this is going to be very important. Patients like us, patients that have heart failure, patients that have Parkinson's, they can share experiences and they can share breakthroughs. So there's some really fine people in healthcare that are altruistic. And I had the privilege of writing a book with Professor Piero Formica of the University of Bologna, and it was about a new culture of innovation towards an altruistic economy. And I believe we can be profitable, but it's very powerful when we have purpose, and it's about progress, and it's about people. And ultimately, I think that's where business will go. We talk about ESG and sustainability, but when businesses have purpose and they make a difference to people's lives, people will buy their services, they'll be really profitable, and it's such a great win-win. Because I think one of the key issues, and work a lot with, honor of working with Professor Elizabeth Teisberg of UT, the University of Texas, who wrote the book with Michael Porter, Redefining Healthcare, and they talk a lot about value-based healthcare, but they say that in healthcare, too many people get paid more to do the wrong thing. So as we look forward, I think there's two main things we need to fix in healthcare. And Larry Keeley, Larry's, the innovation principal at Dublin. And when I was at Intel, I had Larry come out from Chicago to Intel Sacramento. He gave an amazing talk that was really influential in changing Intel's innovation strategy. But the insight he shared was that, and he published a great book called The 10 Types of Innovation. Many companies at that time, Intel and BMW, were focused mostly on product innovation, faster, cheaper, better. But his insight was that was the area of lowest return, and the area of highest return was in business model innovation and in network and ecosystem innovation. And in the work that I'm trying to drive with the open collaborative ecosystem, A, we're trying to use the ecosystem to innovate, but B, we're trying to innovate the business model. And if we can create the Spotify business model for healthcare, that's going to be a winner.
Yeah, that's some excellent points. I suppose one quick question, if I can, just on, I suppose, universal healthcare and providing healthcare for everybody. What about the question, Martin, about, well, if I can afford to pay for healthcare, then I'm going to be okay because the future is this subscription type model. What about people that are less fortunate? What about people in, places or countries where maybe, the income just isn't there, or they're not on the same social economic rung? How do you balance that between providing universal healthcare for everybody and a pay-to-pay type model?
Yeah, well, I think, Simon, that actually is the most exciting and the biggest opportunity. So something that existed for a long time is something called the inverse care law, which is essentially the people that need healthcare are the ones that can afford it most. And what you just described is the opposite. The people that most need it can't afford it. And I think it's similarly to the way that cloud computing has democratized, entrepreneurship. Digital healthcare is going to make things a lot more affordable, a lot more accessible, and available. So the fact that you can do, when we learned older people can, do a healthcare test at home. So my dad, he's, thank God he's still really fit, but, he was able to do his, his antigen test at home. And, these technologies are coming fast and thick. We can do them much cheaper. So I think there's two major opportunities. One is on the affordability and accessibility. So if you're in Nairobi and you have access to a smartphone, you can get as good a care as somebody that's sort of, in a very nice district of Washington, D.C. We're going to be able, because of the scale of industry and the marginal cost of software approximates to zero. Once you get over a critical mass, we can make these solutions affordable, accessible, and available as long as you have, a smartphone and you have connection. But the other big issue that can be fixed is variability is a massive issue in healthcare, and I sometimes talk about Russian roulette. A lot of doctors are great, and nurses, and if you get them, you get great care. But sometimes there are people that don't have the right knowledge, or actually probably more the cause is they're only working with 16 or 70% of the data. So if we can provide a personal electronic health record that has all of the data, it's got your live data, what are your live vital signs, doctors are going to, and nurses are going to make better decisions. So eliminating variability is going to be a great opportunity, and we can codify high fidelity digital care into digital. So no matter whether I'm in Johannesburg or I'm in Barcelona or Berlin, everybody's going to be working off the best of practice. And Professor Jeffrey Braithwaite, he's a colleague that collaborates with us on the Manhattan Manifesto. He talks about 60, 30, 10. They're the three numbers you need to know about healthcare. 60% of care is in line with best practice. And this comes back to the Russian roulette. 30% actually is wasted, and 10% of it is actually harmful. In fact, something like 1 in every 6 or 7 medicines prescribed in a modern day hospital are actually counteracting the side effects of a drug or some sort of, medical error. So I think codifying in this high fidelity, high quality, digital, medical pathways is going to be, a really exciting development.
Yeah, thanks for sharing that. What's the best advice you've ever received, Martin?
Well, the best advice of, lots of good advice. I didn't always follow it, but when in Ireland school I read Hamlet, and Polonius said to his Laertes, "As sure as night follows day, be true to thyself. Then thou canst not be false to any man." So I think you have to be true to yourself. And ultimately, when I left the HSE, I had to be true to myself. And then the best advice, what I try and give, what is at Intel, we established this as our motto, just very simply: dream, dare, and do. So dream it, dare to do it, and actually just do it. And some things might look hard, but once you take the first step, you're on your way and you've got momentum.
I love that. Dream, dare, and do, and be true to yourself. I completely agree. Great advice. Look, last couple of questions before we wrap up today. As you look forward over the next 6, 9, 12 months, how do you go about planning that? What's on your roadmap? What are you hoping to achieve? What does that look like for you?
Well, we've a lot going on at Maynooth University and with the University of Limerick, and we're taking the master's program that we established in Ireland. It's known as 4th year, and we're going international with that. In fact, not global, and we're working with CHIME, which is the College of Healthcare Information Management Executives, and we're going to make that a global program. It's going to be at a very attractive price point, because healthcare is global, and what we're trying to drive is cohesive. We're looking forward to the United Nations signed some with the third edition of the Digital Health Symposium. That's going to be September 21, 22nd. We're looking at a digital summer school at Maynooth University. And so pleased, we're really hopeful that Dr. Jerome Adams, who is just the most recent Surgeon General, first Black Surgeon General of the US, he's going to be one of our keynote speakers. So many things to do, and I'm working with quite a few health tech startups, like Matuzi. Have a fantastic opportunity, going to help one of the Canadian provinces with their digital health strategy. So it's really exciting, but what's going to be most important is working with a network of committed and smart and really nice people. Life is too short to work with nasty people, and I'm really privileged to be working with smart people and nice people that the common interest is at least as important as their own self-interest. So the future is bright.
Well, I like that a lot, and it sounds like, as I'd expect nothing less, I suppose, from yourself, Martin, that you've got a busy 6 to 12 months ahead and some wonderful things to drive forward and achieve. So continued success with all that you do in those areas. And I suppose the last thing I wanted to ask you, if I can, is there anything that we've talked about an awful lot there? We've covered a lot of topics, but is there anything else that you'd like to maybe raise or just share with our audience before we wrap up? And also, and probably importantly, if people want to find out about some of the great work that you're involved in, some of these things that we've been talking about today, where's the best place to send people to connect or to find out more?
Great. Well, they can link in with me personally on LinkedIn. I think it's an amazing tool. And we have the Irish Digital Health Leadership Steering Group for folks that are specifically focused on transforming healthcare. But similarly, we have a global group, and we're in actually Barcelona today with the Global Health Connector Partnership. We've had, we've thought leaders from around the world here, and they can get involved with that movement. I would say, Simon, it's a privilege, and again, congratulations on the global discussion series. It's actually, it's really dense information, and you create thought leaders, and I'm honored to be part of it. But we've made so much progress as a human society over 20 years, 200 years. Life expectancy has gone from 30 years to 75, even more than that. But what we know from the US is how much you spend on healthcare isn't the best predictor of outcomes, because the US is now spending 20% of its GDP on healthcare, but life expectancy is flatlined. In fact, it's actually gone down in the last couple of years. And the number one, modulator or, predictor for healthcare is actually taking a systems approach and a management approach. So we need to completely re-architect the health system, and we probably shouldn't talk about healthcare systems, and we should just talk about health. But we also need top-class management in that, Deming, who was credited with transforming the Japanese manufacturing industry after the Second World War, he says 85% of the problems are management. So we need top caliber managers and leaders that are purpose-driven at the top of our health systems. And I suspect now, Franz Johansson wrote a book, I think, called The Medici Effect, and the breakthrough innovations happen at the intersection of disciplines. And I think the thing that's going to change healthcare isn't going to come from within the industry. It's going to come at the margin. Something that worked in retail, or whoever creates the Spotify for healthcare is going to win.
Well, that's a nice point for us to end on today. Thanks so much indeed for sharing all your insights, wisdom. And it sounds like, despite challenges, the future looks very, very bright. So thank you very much indeed to Martin Curley for joining me today, live from Barcelona. It's been a pleasure to talk to you as always. Thanks to everybody who's been watching or listening to this episode around the world. Make sure that you like, follow, subscribe, do all the things I need you to do to help support this podcast. And I hope you'll join me back here for more discussions with creatives, leaders, and thinkers. So thank you so much indeed, Martin. It's been an absolute pleasure to catch up with you again today.
Great. Thanks so much. Adios. Good luck.